Okay. All right, ladies and gentlemen, are we ready? 6:30. I'd like to call this meeting to order for the Health and Human Services, Tuesday, October 7th. Roll call, please.
Kay Wilson,
Here.
Tweed Schuman,
Here.
Marshall Savitsky, Chuck Van Etten, Jeff Haney, Lorraine Gauger, Dawn Pettit,
Here.
Carol Pearson, Dr. Dunlap. You have a quorum.
And can we stand for the Pledge of Allegiance, please? I pledge allegiance to the flag of the United
United
States of
States of America.
America,
And
one
one
nation, under God,
under God, indivisible, with liberty and justice for all.
I don't either. Can we have certification of compliance with the open meeting law?
This meeting was noticed to the media and the public as required by Section 19.84 of the Wisconsin.
Thank you. The agenda, we would like to make a change to the agenda and move the resolution that was 17 and move it to 9C.
I will make that motion. And I will second it.
Excellent. Motion's been made and seconded. Any further discussion? All in favor?
Aye.
Opposed? So carried. Public comments. Is there anyone here or online that would like to make a comment for tonight? Moving on, we'll consider approval of the minutes from the previous meeting. Motion's been made and seconded to approve the minutes from 9/9/25. Any further discussion? All in favor?
Aye.
Aye.
Opposed? So carried. LCO, any reports from that? All right, Senior Resource Center? Any reports for that? Thank you.
I have a couple things that I can report on. Right now, in the month of October, we have a Halloween meal drive. It's called Spread the Sweetness of Love. Instead of buying candy, buy a meal for a senior. And right now, as of about 4 o'clock this afternoon, and we started getting money the minute we put these out, we're up probably over $4,000 right now.
Nice.
The other thing that we have going on this month is Jody Olney and I, the Health Promotions Coordinator, just finished last Friday our training for healthy living with diabetes, which is an evidence-based class. And we will be starting this class on Thursday, October 16th. It's a 6-week session from 12:30 to 3 o'clock. And we already have 8 people signed up. We can take 16, so we still have openings for more people. We were targeted at the WEHA convention, annual convention this year that they have every other year. It's the Wisconsin Institute for Healthy Aging, and Sawyer County was one of the counties that was targeted in Wisconsin that has the highest incidence of diabetes. So we were able to, there was a grant provided by the state for this training. We were able to, Jody and I were able to take the training, and we were also able to, the last 2 weeks, offer the training in Sawyer County. So it was LCO, Bayfield County, and Hayward that did that. So we have trainers now, and Jody and I will be coordinating with LCO Health Center and with Mary Wolf at the senior site there in classes in the future. But Jody and I are starting one on the 16th. So if you know of anybody that has a family member who is suffering from diabetes, either it's pre-diabetes or type 1 or type 2, they're recommended to come. It's a wonderful program. I learned a lot having been in a family that has a lot of type 2 diabetes. So if you're interested, you can always call us and we can give you more information, but that's what we've got going on right now.
I got a question, Joe. So you represent Senior Resource Center, and I know your request in the 26 budget, what we're giving you is less than your request. Do you care to comment on that at all?
Well,
Because we really haven't heard from you. We're all fighting for our seniors and
no.
we don't want anybody to go hungry and we want to feed everyone.
The other campaign that I'll talk about too, after some information that we got at our training last week with Region 4 for cooks for northern Wisconsin, we were told that the state of Wisconsin cut $21 million for Meals on Wheels for the next 3 years. So that means, with state of Wisconsin will get no money for Meals on Wheels the next 3 years. We did get a little bit of an increase at the federal government, but we got no money for Meals on Wheels for the next 3 years. The governor had it in his budget, but they took it out, so that was $21 million that we lost. So that's why we're doing the October campaign. November, it's just going to be SOS, Save Our Seniors, with a turkey trot theme, where every feather of the turkey will have some kind of educational information about the senior center and what our programs do in Wisconsin for our seniors and why it's so important for the Meals on Wheels, the congregate meals. We do Lifeline at the senior center. We have support group for people that have Alzheimer's and dementia for their families. There's a lot of things that we do that people don't understand and don't realize what we do. So that's why each month now we've picked a campaign. In November, it will be SOS Save Our Seniors with a turkey trot theme. So every feather of the turkey will have that. So it's more than important to us that we get that money. I had a meeting with my cooks today for about an hour and a half, and we went over some of the scenarios. If we don't get the money we need, what we're going to have to do. Some of the things we'll have to do is some of our sites will probably only be able to do Meals on Wheels 2 or 3 days a week. One of our sites, like I'll use Stone Lake as an example, we don't know for sure, but one of the scenarios I came up with, we may be only able to do breakfast and Meals on Wheels, no lunch, no carryouts, no dine-ins at all. Okay, our Excellent site might have to go to being open, 2 or 3 days a week with Meals on Wheels, only 2 or 3 days a week, and then the other days they'll have to get frozen meals. Hayward, probably the same thing. We might have to limit the number of hours the site is open. The building is open for people to come in and do socialization and stuff like that. Also, what just happened in the last couple days, I so far have replaced our server. I also have to replace, because of the changes with Windows 11, I have to replace 6 laptops plus our secretarial computer that runs all of our programs, all our web-based program for the bus and our meal program. So that's why we need the money. We also, from January to June of this year, Mary Jo hasn't done another update for me, but from January to June, we sent out $101,000 in contribution letters for our Meals on Wheels recipients, and we got $48,000 back. That's why we need the money, because we have seniors out there that can't afford the meals, and that's the only thing we do. There is not one route we have in Sawyer County that doesn't have at least 1 or 2 people that have dementia or early onset of Alzheimer's on our routes. Just in the last 2 weeks, we've had 2 people that have been placed in memory care units and another person placed in a psych ward out of county. And those are all people. So the one lady that was placed out of county on a mental hold has a husband sitting at home in a wheelchair with diabetes that's on dialysis that we serve meals to 5 days a week. We have a lot of people that the hospital calls and we deliver meals to them while they're recovering or before they go into surgery. That's why we need the money. And I don't have one site that's not at capacity for staff. In Hayward, for example, our head cook has no support on Wednesdays and Thursdays, so when we have a meal or we have a large number of count, Joey goes upstairs. I go in every morning from 7 o'clock to 8 o'clock, put all the meal counts together, so when the cook comes in, he knows exactly how many Meals on Wheels he has to cook, how many people are coming in to dine in at that time, and I do all the route sheets and all the special instructions for all those routes. In Stone Lake, they have to do it all themselves. Heather has to do it all by herself in Excellent. One person. We have 2 people in Stone Lake right now, but the numbers are going down because the people have gone away for the winter. So we will be moving that one of the individuals from Stone Lake up to Hayward on Wednesdays and Thursdays. So I don't have to go upstairs all the time, but it's okay. One thing I can say about my staff, so many places where you work, A lot of people, this is my job, I'm not going to do it. I have to say, I do not have one team member that will not step in and help another person. I've always been of the belief, any job I've had, if I'm the boss, I need to know how everybody does. And unfortunately or fortunately, I can do everybody's job. If somebody gets sick or something, I can step in and do it, and I can say the same thing, even with my health promotions coordinator. She can step up. She doesn't like to cook. She's very good at pouring out cereal and pouring milk on it, but she will do dishes and anything else. So I'm very fortunate to have the staff I have and the caring and compassion that they have for our seniors in Sawyer County. That's why I need the money.
Joey, if you were to receive the amount you requested, would that keep the centers open 5 days a week?
What the centers will be open. I will make sure that those centers are open. We might have to change how we operate and how we do business, but there is no way that if there's a senior out there that needs a meal, that they're not going to get it. Whether they can pay for it or not, whether they can contribute nothing or 10 cents or 50 cents, they will get a meal because they need it. We have a gentleman right now that helps us out at the senior center that just had surgery, and he has to walk up 20 steps to get to his house, up to his apartment and stuff like that. You know, so those are the people that we're serving, and those are the people that need our meals. So no matter if I get the money or not, my staff and I will do whatever we have to do to keep our doors open. Welcome.
And let's talk about the resolution. Mike, do you want to?
Is the 8521 grant. That is a DOT grant that we pass through right to the senior center. I've spoken before about our contribution from general fund and the pass through. This is the pass through that I talk about. So it does have a small local match too, but it's almost an $80,000 grant. It's the same amount every year, and we have to pass this resolution every year. So pretty simple.
I'll make a motion that we approve the resolution authorizing Sawyer County DOT grant application.
I'll second that.
We have a motion and a second for the 8521 grant. Any further discussion? All in favor?
Aye.
Aye.
Opposed? So carried. So does this move on to the county board then?
Correct.
All right. So do we need to make a motion to move it on to the county board?
No.
Okay. All right.
Just sign it and then we'll move it on.
Okay. So administration, Julia, do you have some updates here?
Yes, oops, let me get that up a little bit. Okay. Just a few admin updates to bring forward. Staff are feeling a little overwhelmed right now. We have referrals up in all areas. So just a little stressful for everybody. So that's really what we've been doing as supervisors, is kind of trying to jump in when we're able to, help assist, give a little pep talk, try to smooth things through to make things easier for people. But you'll hear as we go through that all areas are feeling kind of the strain at the moment. I'm not quite sure why everything is coming to a head, like starting in August. It's July, August, but it just seems like all referrals are up. So we'll kind of keep an eye on that and keep you informed. Some of the priority projects that we're working on is implementation of the new electronic health record. So all the training is started, and we anticipate, on top of referrals and things being higher, that staff are going to need to learn that new health record. So that'll be an additional piece. Due to that, we won't be having an all staff this fall. We'll request it probably for January, just because we just can't afford to pull everybody off at any more than what we are due to training. We're working on realigning workload due to attrition. We did not replace Carol in fiscal, or Kathy Garby, who just retired. And we did get to celebrate her retirement last week. of 38 years, so that was nice. And then also Joyce Knowlton, we celebrated her retirement as well. We will be having an open position for CLTS as Terry Brown is retiring. We do have that posted, and we just set up an interview, and hopefully we'll have a second interview for that. We did interview and hire for the admin assistant receptionist position that's been vacant since May or June. I can't even remember now. Time is going quickly. So that position should be filled pretty quickly here, hoping that she'll be able to start October 14th. Other things that we're working on is changing placements to help reduce out-of-home expenses, working on a central referral process, developing CCS providers in the community so that we're able to take referrals, and billing for targeted case management. So those are just kind of some of the things we're working on. In addition, I need to announce that Carol Pearson has decided to put in her retirement. She has been with us for over 40 years in this role here, and we have been thrilled to have you here. You've been very helpful for me along the way, and I know that you've helped everyone along through the years to be able to help us move in the right direction. So very much appreciate that. So I pulled out the bylaws because I did remember she caught me in the parking lot. So I got just a little touch of a update on that. So I've received the resignation. Then what we do is the county administrator will help fill that vacancy and bring that to the board for approval. So we can kind of talk through what that looks like. So on the next meeting, hopefully we'll at least have somebody who might be interested, whether there be, well, they won't be approved yet because it'll have to go through the county board for that.
Carol, when will that be effective?
Tomorrow.
She's greatly hoping this is it. So if we want to be able to like acknowledge her, now is our chance. Maybe we can get her to come back.
Well, I want to thank you very much for all your years of service. I cannot imagine spending 40 years at this.
Board director.
Unbelievable. And thank you.
Great.
Thank you very much.
I told Julia if you didn't have a quorum, but once my resignation is accepted, I can't come back to fill a quorum, so I don't know what you're gonna do about that.
Well, we're going to have to act quickly.
Yeah.
So that's it for updates for me on the admin side. I don't know, Mike, did you have anything additional? Going into fee schedule then, if that's okay to move into that. Just slight changes in here. For fee schedule updates, we have not updated our OWI assessment in years and years. So we'd like to move that from 250 to 300 and amend the amendment for driver safety plan to change that from 50 to 75. And then on the back side or on the next sheet of this, just some wording changes for the fees that would really be under adult protection. And then I was made aware, as Kathy was leaving, that we used to do home studies for adoptions, which we did not have on our fee schedule. And I'm not sure that we'll have capacity to be able to do that, but thought it would be good to add that to the fee schedule. We stopped doing them in '23 when we really lost all of our staff. We are fully staffed up, so maybe at some point we'd be able to take on some of the home study adoptions assessments. So that is, that's on there as well. No changes as of yet for the for the agent program with housing, or excuse me, not housing, TRH, lodging, food. We'll be watching for that. Again, those might not come out till the beginning of next year, so we may just need to bring those through, but we'll need to match those up to the state, so. We have the slight amendments here, and I believe we have to vote on that to be able to move that forward to the board. Is that true? Yes.
I have a motion to approve the amended fee schedule.
Sure.
We'll make that motion.
And I will second it.
All right, a motion's been made and seconded to amend the fee schedule for HHS. Any further discussion? All in favor? Aye.
Aye.
Opposed? So carried. Let's move on to Aging and Disability Resource Center.
Okay. Carol is unable to be here today. One of the things that I wanted to make note of, I think that's been big for us in the last month and a half, is that we actually needed to do 3 Chapter 55s. We're used to talking about Chapter 51s here. Excuse me. Chapter 55 is somebody, an older adult who needs to have a commitment to be able to move to like Trempealeau, Clark County, someplace related to dementia, Alzheimer's type of thing. One of the ones that we had started as a 51, and this is the difficulty with aging is sometimes dementia, Alzheimer's can mimic mental health. So we're bringing people into the emergency department. Caitlin's group from Northland then needs to go in and do the assessment. Sometimes it's really not clear, we're not quite sure, and then we can do a 51 on them, and then transition that over to a 55 after 72 hours. So that's what happened on one of them. The other 2 are Chapter 55s. It does place the county on the burden when it's a commitment like that for out-of-home placement. We are able to then go back in and recoup the costs, hopefully for those out-of-home placements. But we did have struggles with the one. Had to be in the hospital, I think, for 5 nights, which is unusual. We were unable to get a placement. So what we do is quarterly get together with law enforcement, behavioral health, the hospital, ADRC. I'm trying to think who all is sitting at that table. I'm looking at Marshall because he's always there with me. And we kind of work through issues that come up. And this was a big one because when it's a Chapter 55, law enforcement has to stay there until we find placement, the same as with the Chapter 51. So law enforcement needed to be at the hospital and taking custody through the weekend. And I don't believe the person got placed until Tuesday. So a lot of resources used in a process like that. A lot of people needing to kind of work through and figure things out. We did have to get a new contract with, can't remember where Kitty Rhodes was at. Do you remember where that was at? I think that was in Polk County. They opened up it is for a dementia crisis care center. So 28 days max. So we were lucky enough to be able to have that person placed. One of the other things that we struggle with on placements is that if that person has been known to be a difficult placement in the past, that usually we end up finding that maybe places they were at wouldn't take people. So this particular placement was known at a couple of facilities and they declined placement. So that's where we kind of get stuck, and that's why it took it so long to get placed. So those are the things that we are going to continue to face, and something maybe that we want to consider growing with a couple of other counties being able to have Dementia Crisis Center that would be closer for us up here in the northern region. I know there are innovation grants with Wisconsin that could be a potential, but just something to keep on the radar, especially as we're doing strategic planning. That is it. That kept us busy. Yep.
With the 55, my understanding a couple years ago, there wasn't even a place for those folks. So now there is one in Polk.
Yeah, well, we have a contract with Clark County. Clark County will take a placement. We could potentially work with Amory. And there's just very few. And yeah, this is brand new because I hadn't heard of it before. And then that was brought forward for me. So that's.
Well, with the population that we have in Sawyer County, I think it's a very important issue
Mhm.
to keep working on, because you're going to have more and more.
Yes, yes. So let's knock on wood that we don't have a 55 for a while. Oh, yeah. Yeah, I've been sitting in a lot of court hearings for 51s and now we'll be having the 55s, so. We have the other benefit, I should just say, 51s, they're a quick turnaround. You got to have those turned around within 14 days to be able to have everything you need for your doctors to confirm whether they need to be placed or not. We do have a little bit more time with a Chapter 55. We have 30 days. There is a benefit, so that's a really good benefit. And many times the dementia could be caused by like a urinary tract infection or other infections that can cause dementia type responses that then can be cleared. So that is the benefit of having a little bit longer time to be able to get those assessments done. Okay, now I think I'm done.
Now we can move on to behavioral health report.
Okay. It's been pretty busy in that area, working on CCS and CLTS. Been having quite a few meetings, and I think Alicia is on. She may have.
I am here.
Okay, would you like to give just a brief update?
Yeah, brief, sure. Yeah, it's been quite the month. Let's see. OWIs, I think this month was our highest month with 8. I'm not quite sure the reason for the surge in that, but this year to date, we've done 46 assessments. CCS, I have been working very diligently to try and reestablish this program, reaching out to numerous different psychotherapists. Thankfully, Caitlin Myron, which you all are acquainted with, she is CCS certified and she is willing to provide psychotherapy services for CCS. So that was really exciting to hear because we've been struggling trying to recruit someone to fill the position that's been open for a very long time in my department for a therapist. So Caitlin, she's been working with Taylor County because she is a contracted provider. Caitlin has to contact Taylor County and set up her contract through the NCR CCS consortium, which she has done, and we are ready to go. We've got everything straightened out. We are kind of, some of us have quite a few hats that we wear. So Haley Sands, even though she is a CLTS service and support coordinator, she had originally been a service facilitator for CCS. So we are going to switch up some of the clientele that she has so that they are, if they're enrolled in CLTS and they are functionally eligible for CCS, she would take on that caseload. So we may have to switch some of her clients. In the meantime, we have Terry Brown, who is leaving. So it's going to be a fine balancing act with 60 people on our CLTS program and then starting up CCS, also learning a new electronic health record system. All of this seems to be happening in the end of 2025. Julie and I are also working with another possible therapist to do part-time work. As a psychotherapist for CCS, we haven't finalized that. But that would give us 2 people. And CCS, there are certain timeframes that we have to get the enrollment process done within 30 days. There's a great deal of paperwork, so it's not as though we can take 10 referrals and get them all in a matter of, 2 weeks. It does not work that way. The 3 referrals that we did have, we started working with them. Unfortunately, one person had private insurance, which one of the requirements for CCS is you have to be on Medicaid. So that referral fell through. Another one had already established care through Marshfield Clinic in less than 12 hours of sending in their referral form to us. So that was a quick turnaround on their end. And the third person decided that they did not want CCS after hearing what they would need to do to qualify for CCS. They did not want to go through the assessment process. We are going through our CLTS caseload. Today I identified 3 potential candidates. So tomorrow I'll be staffing with my CLTS workers to get more information, and we'll be moving forward with that. So that's pretty much been my focus this last month between CCS and CLTS, trying to figure out where all those pieces are going to work with Terry leaving, and then trying to reestablish CCS. But it's moving along in a good direction. So we're trying to stay positive with all the changes and people leaving and things of that nature. CST is going well. We've got 6 clients right now. Allison is still engaging in the Canes Club after school program. She's doing that once a week, and they had asked her if she'd be willing to do it twice a week. That program really serves a lot of kids. We're approximately around 75 kids in 4th and 5th grade. So she does that on Tuesdays from 3:15 to 5. CLTS right now, when I wrote this, we had 59 clients. And we had received 4 transfer clients in one day from Rusk County. And when we receive transfer clients, we cannot not provide services. We have to take them on and engage within 30 days. We cannot put them on a wait list because they are already enrolled in the program. We've had 2 discharges, 2 suspensions due to being in a higher level of care. And that 1 pending enrollment is now enrolled, and we are up to 5 referrals from the date that I wrote this on the 24th. So, like Julia said, the referrals just keep coming in for CLTS. A lot of people seem to be moving into Sawyer County. I'm not quite sure why, but yeah, it just keeps going up and up. So hopefully we will be able to find a replacement for Terry, because it will be difficult to split 60 children between 2 workers, especially with Haley also having to re-engage in CCS. So that's what's been going on in my department.
I got a question, Chairman. Julia, do you see where behavioral health programs have a direct impact on the out-of-county placements? Is that something, I mean, if we have a strong, healthy behavioral health program, that maybe we see less the need for out-of-county placements?
There could be a potential for us to be able to do that. I'm just thinking of some of my ones that have just crept up that have been in Winnebago and whatnot.
Yoda.
They haven't necessarily been anybody that's been on our radar. But one of the things, and I don't think Caitlin's on, but one of the things Caitlin and actually, Alicia and I were talking about this today, is really trying to look at it when she does have mobile crisis. So the benefit of her doing it at the hospital and for us is she has eyes on all crisis that happens in the community, at least if they make it to the emergency department. And, a lot of times they aren't placed, they're sent home on safety plans. From those safety plans, if we're able to move them into a CCS, so say that and I want to I think both programs are important, CCS and community support program, CSP. You need that community support program for those that have those high mental health needs. So they are taking multiple medications, and if they don't have those medications and they go off those medications, then they're going to get hospitalized. Those really need CSP. But there are some of the people that maybe would have a short stint in Winnebago, and we could maybe prevent those. So with CCS, if we can pick up some of those mobile crisis clients and move them into CCS to help support them through that struggle that they're going through. In fact, today, got a call from, actually, a call came in to Children and Families. It didn't make a CPS criteria to be referred, but then Erica came in and discussed the client with me. The client, it does have some suicidal ideation, but not anything that would be like a Chapter 51 right now. Looking at, okay, that would probably be a good client to be able to move in, make that referral for Caitlin, and then be able to move that into CCS. So those are some of the avenues we're looking at. The other avenues that I think we have higher risk for people being hospitalized are those that are coming out of the jail, and substance use disorder and different things that could potentially kind of escalate. So we're looking at, okay, what can we do with that population, or those that are in recovery court with CCS. So looking at multiple avenues right now on being able to bring people in, but strong avenues for behavioral health across the board, whether we have it at the county, we have, North Lakes, we have Beziki, yes, Beziki. I forgot if it's still called that. It is, though. At LCO Health Center, all of those avenues are important to be able to split and work through. So long-term out-of-home placements are typically, because it is a 51, there's high significant needs of mental health. So we have 4 people that are on mental health commitment long-term that we're unable to get them out of that commitment with us at this time. So needing to look and being flexible on that. So long-winded answer to your question.
Oh, helpful though. And Mr. Markren, isn't this the area you talked about in your budget report to try to drive more revenue from behavioral health programs? You want to explain that?
Yeah, CCS is a 100% funded program. So like there's a neighboring county that gets about 1.65 million in on that. So if we get it running strong, and it's a good wraparound program too, like Julie was mentioning, but there is some solid revenue attached to it as well.
Really? So there's insurance and we collect on that insurance?
The state makes it.
It's only medical assistance. You have to have medical assistance. You can't have private. So Alicia had alluded to that. One of our referrals was a private insurance. It does not qualify for CCS services. So one of the things that I talked about too at the beginning was looking at a centralized referral process. That with those centralized referral processes, we can analyze the financials right away. So you call in and we're getting a referral, but we're also getting the financial details right away. So then we're not spinning our wheels, calling and trying to get people into programs that they're really not eligible for. So, and then we would be looking at functional screen. How do we streamline that? Is it a CLTS? Is it a CCS? They both have the same type of functional screen. There is other screening avenues that we would use for CSP as well. So aligning and trying to move people into those. The ones that do make the good profit are the people that, when you make money on it, it is because you actually have the workers within your county and they're county workers. Because if they are contracted out, they send their bills into Taylor County. Taylor County then pays them and then and does the billing to medical assistants. So say the MA rate is $128 per hour. And the fee is actually $150 per hour. The county would have to pay forward that $30 or whatever that difference is. But then on the back end, to Mike's point, on the back end, then we can turn that into the state. We get it in WIMCR funds the following year. So I know I've talked about WIMCR a few different times, but that's kind of how that program works. So,
Thank you.
okay. We've been talking a lot on these things.
I think we are going to talk about community support and mobile crisis.
Okay, Caitlin Myron has brought forward her report for the community support program and mobile crisis. You can see that, again, they saw a dramatic increase in August, and I know September has been busy as well. We are also going to be looking at the community support program to determine if we should be pulling some people off of that program because now they have Inclusa and may be living out of the area, and so that we can spend more time really focus on the people that live right here in Sawyer County. So even though they're can still consider Sawyer County residents, they're placed out of the county, we want to be able to kind of realign and refocus those. So we've been looking at the caseload there. So that's where we're going with those things. Shall I keep moving along? Okay. Looking at mental health monthly expense report. We have had somebody in Winnebago pretty consistently for the last number of months. So those costs are up right now. We have, and I'm going to kind of combine both the discussion with the monthly expense report and the cost by client report. Moving into the cost by client report, as we're looking through, I kind of really looked at who we've got on, and client B is now in Winnebago right now. We did lose that placement. That's that expensive placement that was in Encanto Falls, or Encanto County, excuse me. But I have been working, we actually have weekly meetings with Winnebago trying to establish placement. One of the ways that we could really reduce our costs is if we can transitions to be able to have one side of that building be able to handle that client. That would be internal costs that we already have for keeping that going. And if we can figure out how to bring that in and support that client, that would help tremendously. Client D as well would be another client. We wouldn't have 8 beds in there. We would be down to 4 beds. Hayward Police might be called occasionally to respond. So that would be the probably the negative part of that. We would want to make sure we have a really good plan in place for some of those pieces. So anyways, those are kind of the ways that I'm kind of looking at how can we potentially get clients back in the area into housing we already have, reestablish what that housing or the CBRF is actually used for, and see if we can develop it that way. So that'll take a bit of transition and training and staffing planning. In order to be able to get client B out of Winnebago right away, I am looking at a potential step down where they would step down into transitional housing, maybe get a little bit more focused on the community and reestablish there, and then be able to move into transitions if we're able to get that staffing plan. Carol looks like she's like, ooh, what are you thinking? It's work, but I don't know how else to be able to try to get those costs in. The other value is, having people home in their community versus just housing them somewhere for years and years. I'm trying to be able to use our CSP program to be able to help support them in their community efforts. Is better for their life as well. So can we make that happen? It's kind of like the intensive foster care I was talking about. Can we make that happen? Because living in a residential home or a group home is not a place to be raised for a child. So I have good dreams.
Julie, are we in line with our budget with that number there?
No, we're over our budget.
Huh?
We're over budget.
Over
on
budget.
outer. Yeah, that's why we have to be creative. So I'm working on being creative. We've had, compared to last year, it's, our 51s have been a lot more. So, and they've come out of the blue, like some of these, this is why when Tweed asked the question that if we have a good behavioral health program, well, I tell you, I think 3 or 4 of them, we didn't even have an eye on. They're not even, we just had somebody that we just did a stipulation on today and we had no idea about. So, was in Dane County and ended up getting hospitalized at Winnebago. And we find out that it's a Sawyer County resident. So some of them, they come out of the blue and we have no idea. But hopefully this one will be a quick turnaround. But again, that's where CSP comes into play because then they help us get them back out into that community, get their meds on check, get them going back to their therapy and doing what they need to be doing, and then hopefully just getting them integrated back into the community. So, okay.
Those facilities have to have like locking doors and state-of-the-art windows and technology and stuff.
For what I'm talking about, for the client that I want to move here,
I'm just saying, if we spent $2.6 million every year for the past 20 years, what would it would be money ahead building our own,
oh, yeah.
you know, buying a school and redoing it or something? I just,
Yeah, the Winnebago ones, the difficult piece with the Winnebago piece is that, well, there's hopefully light at the end of the tunnel with that, because one of the things that President Trump has put in is an emergency resolution, I think, relating to homelessness and taking care of people with mental health needs. And it sounds in having medical assistance be able to pay for those things. And if you guys remember when with Winnebago, it's considered an IMD, and I do not remember what that stands for, but I do know that that means that medical assistance no longer covers. So we did sign a waiver as a state, and hopefully that will get fast tracked through. So that waiver is asking to be able to use Medicaid dollars to be able to pay for those stays. That would greatly, that would be amazing for our budget, should that happen. Got any more?
Let's talk about kids, child, youth, and family services.
Okay, so I just pulled together a new chart for you just to be able to help you see the out of home. Thank you for making that a little bit bigger. Being able to see what we've got going on with out of home care placements with children. Kind of gives you an idea of how many. I know Kathy puts together the list with the number of days and things, this one that's kind of a table. But this one just kind of gives you a little different look in the number of kids that are placed and where they're placed. When they're in subsidized guardianship, which is something that we liked, it's great to be able to move to. Subsidized guardianship means that we don't have any county expenses related to those. So that's kind of the way to be able to transition or transition them into finding permanency and adoption. So those are all the mechanisms. But you can see that we have a few in residential care. We have a couple in treatment foster care, so that's a little higher end. We do anticipate some of those transitioning back out again on the treatment foster care. And residential care, that's where we're kind of struggling with, we're having kids with high mental health needs. Instead of, going into a Winnebago for long-term, they go into residential care where they have more intensive therapy to be able to meet those needs. So if we could transition even a couple of those into I forgot what I called that intensive foster home. That's not specialized foster care. No, it's not treatment foster. It was the one that maybe we make our own treatment foster care. I can't remember. There's a different name. Anyways, I talked about that last time. But if we can transition even a couple of those, that will be huge. So that's that report, and that really covered the children in care expense report. Again, Kathy Garby has retired, so this report that you see with the table will look different because I can't recreate that. We're going to come up with something else. So she's very good with tables, and we're better with spreadsheets. So. Okay, and then the other piece that I had, not only where they are, but also just from January to August, just to give you an idea of why people have been removed and for what reasons, and where they're at, just another level report in there. And if we don't have any questions on Child Protective Services, we can move into Youth Justice with Sarah.
Hello. So I wanted to give an update on our new diversion program. I know it was probably a couple months ago now that I spoke just in regard to the program getting up and started. It was still very new without a whole lot of numbers or data to kind of back everything up. So this year, between the months of January and June, we received a total of 11 referrals. From July to present, we have received 8 additional referrals since school has started, and we also have 7 pending intake scheduled for referrals from LCO school and tribal court. Some numbers that I'm pretty excited to share is just already showing the success of this diversion program and getting in with kids to work with them at an earlier point. We have kids that were habitually truant. Let's see, what was I going to say? Habitually truant historically. This year, within the first month of school, and again, I know it's early to be fully excited, but I'm happy with these numbers. So since school started this year, we have, of the referrals we've received that we are working with, 15 of those kids have 100% attendance at school. We are really motivating kids through using incentives rather than coming from a punitive, punishing type of hand. We have found this to be pretty successful thus far. I'll just run through the rest of the numbers. We have 3 kids attending at 90%. We have 1 kid attending at 80%, 3 kids attending at 70%, 4 kids at 60%, 4 kids at 50%, and then 2 are less than 50%. So if you recall, talking about truancy is a very difficult kind of piece to handle because a lot of social workers joke that, we don't have a magic wand to make these kids go to school. And even if we have a court order, there's just not a lot of teeth behind truancy because we can't put them in juvenile detention. We can't send them away to a residential facility. We do the best we can, and we hope it's making some difference. So, with the first number alone, to say 15 kids that used to be habitually truant are now attending 100% of the time is enough for me to celebrate right there. So as we continue moving through this program, and by the end of the school year, I'll have a full year review as to what these numbers continue to look like, and just different data surrounding the new programming and success rates. So of the ages that are of the kids where I talked about the percentages of attendance, 3 kids are less than 10 years old. 1 kid ranges 10 to 12. 13 kids range 13 to 15 years old. 12 kids range 16 to 17 years old. And we actually worked with 3 additional youth that were very close to turning 18. I think those are 2 of the ones that I'm saying like are less than 50% or were not considered successful. Yeah, unfortunately, when we get to that age, there's not a ton we can do to help get them back on track. But with this program, I think we're going to be able to now get more of a heads up to start working with kids sooner and see more success rates. But something that is really exciting of the 3 18-year-olds is there was one who, I mean, the legal guardian didn't feel like we were going to make any difference. It was just kind of the end of the road. She doesn't follow along. She doesn't listen. She's fully back in school, and a lot of that is she had a lot of anxiety. She had psoriasis where her skin she was embarrassed to be seen like that. So the legal guardian wasn't assisting her in doing the things to help her be successful. And so the workers within my department took the lead and got her the help that she needs, and now she is successful. So we are fully confident that she's going to graduate this year.
Can I ask a question? So I didn't in my head add up all these numbers. How many students are you working with total?
So in diversion specifically, we currently have about 32 kids that we are working with, and we also have the 7 pending intakes that I talked about.
And what are some of the incentives that you're using for these?
So when we first start meeting with them, we actually sit down and we have a list of the options available for incentives to really figure out what drives each kid, because they're all different. So some of those things are McDonald's gift cards, Quick Trip gift cards. We have phone bank like chargers so that they can charge their phones. We can do minutes on their phones. We have Amazon gift cards, and then we're actually doing like mid-year, this as well. So one of the things we're also doing is like when half the school year is completed, and again at the end of the school year, for all the kids that we can say we feel were overall successful for the school year, we're putting their names in for a bigger drawing, which is a $100 gift card to Foot Locker, a $100 gift card to Amazon. And all of these things are through grant-funded sources.
That was going to be my question. If any of this diversion activity is grant funded, and do you work with Justice Point and those grants?
So we do not directly with Justice Point. We are planning to kind of collaborate and talk to them about how they kind of have their, what is it?
For recovery court and how they celebrate.
So the ones that graduate from there, we just want to talk to them to see how they celebrate those clients and maybe implement some of that into our juvenile programming. Another thing, well, let me go back to this, kind of to your question. So a lot of things we have been doing in my department and trying different avenues of saving the county money, and has been thinking outside the box as to what else can we do? Because we know we're rural, we know we have limited services, and so it's getting these grant-funded opportunities to basically create programming that Sawyer County needs. So it's taken some creativity. We also, I applied for a foster care kinship type of grant, and basically promoting the longevity of foster parents, feeling appreciated and like they want to stay here. So we're actually, in May of next year, because that's Foster Parent Month, we are planning to use those grant funds to actually host a nice dinner for them at the steakhouse. This is something way bigger than we've ever been able to do, and Peggy, the owner there, has been very gracious and passionate about working with our foster parents and giving discounts and providing a nice meal. So it's a lot of grant funding and thinking outside the box.
So yeah, all the diversion work that's happening. It's not county money at all. Everything is slotted towards working on the diversion program, grant, or, they pay for incentives.
Thousands of dollars through
Yeah,
grant funding.
to be able to do this. So the other thing, like, this is a monthly reward, or an award that is given out to, and whoever is really like going to the top of the class, like,
The month, right?
yeah.
The normal kids that are in school, like, they get recognized for being student of the month. We wanted to tailor an award and focus on these kids who normally probably have never received an award in their life. And we wanted to say, we see you, we see all the progress you're making, and we're so proud of you. And so we actually are giving out our very first one for the month of September. And the mom literally said, oh my God, my son has never received an award in his life. And so I just think it's really cool and important to recognize these kids. Let's see.
And stop that, sure. I don't have anything else.
We are also, if you guys recall, we had contracted with Serona Recovery for trying to do more in-home type of support and working with parents to kind of empower them to take more of their parental role back, because we know a lot of the kids we're working with, they are running the households, and to kind of work with parents on that. We found it very difficult to be successful because Serona was a program based out of Milwaukee, I believe, and they just really didn't understand the unique dynamic needs of Sawyer County and what our population is like working with. And it just seemed no matter which way we went, we were making very little progress. And so what we determined is we had a conversation with the director from Journey Day Treatment, Steve Nagloski, and we basically kind of pitched and planned this idea of how they could better meet the needs of the parents and take over the portion of the grant for Serona. So we're doing parenting groups sessions where the first 3 weeks are with the parents only, and then after the 3 weeks, they bring the kids in. And so it's a lot of skill building and working on healthy communication and anger management across the board. And then a worker from there also goes in and does individual work with each family specific to their unique needs as well. Our plan is it's a total of 12 weeks. Once that program is over, we do a soft handoff to a therapist local in the community so that they can continue to provide support to the family, so that they're not just kind of dropped and left to flounder after the program ends. So this is very new. We started our first session last week, Wednesday. We are also planning to provide incentives to the parents of if they attend, each session they attend, they get a $10 gas card to kind of promote people wanting to go as well. Any questions on any of that or new programming? No, okay. Another area that we are working on, it's called Tall Cop, and this is something we are all very excited about. Myself and my team, we just learned of this individual at the WJCIA conference, which is the yearly juvenile conference. So this man goes around to different states, counties, and he basically does like a little investigation as to different CBD stores, gas stations, and looks into what all they're selling, because there's so much being sold that people don't even realize what it is. I mean, us kind of people, we're like the families, the kids, they know they can go in there and they know what they're looking for and they get it. But what he explained is things are being sold out of these dispensaries that are basically the equivalent to opioids, and it's legal. Gives the same effect, and just different areas of kind of that shocking value of, okay, similar things to opioids or fentanyl, or it's just kind of crazy that it's legal. So he's gonna work on that. He's gonna do a presentation as to what is all going on in our community. We're gonna work with schools and local stakeholders and try to be more preventative and planful surrounding this.
So that's going to be November 12th. That will be a 4-hour presentation, and we'll make sure that that goes out to all board members from HHS board and the county board. Obviously, all law enforcement, schools, as Sarah noted, any stakeholders that could be influential, or, you know, just being aware of what kids can get their hands on, what things look like, you know, vapes look like USB jump drives that you put in your computer. Like, there's so many different ways that things can be hidden as well.
Like they're in class,
Yes.
a vape pen that has THC or whatever in it. And they just,
So
unless people know what they're looking for,
Yeah.
they're not going to realize.
So LCO actually, I think in 2018 or 2019, had Tall Cop come into the school and do a presentation. It was very successful. So we were talking about it on prevention side with LCO, with the Prevention Coalition, and looking at funding on that side. Sarah goes to the conference and she comes back, like, we got all these people talking about Tall Cop. And one of the things that we did put into our funding sources for those grants was to be able to have somebody come in and do a presentation. So we were able to kind of mix funds together to make this happen. Melinda, who is our diversion worker, talked very, very nicely to Tall Cop to try to, he said that he would come to our community and make it work, and he is going to make it work, so.
She has a way with words.
So, there you go.
The last thing I was just going to touch on is in youth justice, we continue to see significant weapons, guns, illegal guns in the community. And this obviously poses a threat to our community and workers going out trying to work with these kids and families. There's an uptick in gang violence. And so we are having a meeting next week on Thursday to talk with our local law enforcement entities, the DA. Julie and I are going, and we're going to start to talk about what can be done right now before this gets completely out of hand like it was 15, 20 years ago. We definitely don't want to go back to that. And so just putting all those brains together to figure out where we can go from here. That's all. Any questions?
Good comment.
Yep.
That Tall Cop is well worth going to see.
Great.
I seen him years ago when I worked for the sheriff's department, and we went for some training, and he's good.
Good.
Mhm.
I didn't realize he's still doing all that.
Yeah, well, we're super excited about it because we've been hoping over the years we've been able to get them. So
Good.
great. That's good to hear. Okay. And we don't have a time yet. We're negotiating. So because we'd like to have it at LCO University, which is a great place to be able to put a presentation on. And Carrie is kind of working with them, trying to figure out what time we can make it work in there, because it is a 4-hour presentation. So it is a chunk of time.
We have CGCC that day and also the county board that night.
Is the night. It'll be during the day. I might have to miss CJCC because I do need to go to Tall Cop. So we'll need somebody to chair, maybe everybody who goes to CJCC should be just going to listen to Tall Cop that day. Could be something for that. Okay. Shall we move on to economic support? Okay. And I see Shauna is on the line. Shauna, do you have an update for us?
Sure. I submitted the economic support unit update for the month of August. For Sawyer County, we had 1,064 food share cases, serving 1,809 food share recipients, and benefits totaled $265,359. And then for the Medicaid side, Badger Care cases, 1,346. Our elderly, blind, and disabled cases were 218, and long-term care cases, 160. We served 17 childcare families. And then there's data also for the Northern Income Maintenance Consortium. Our timeliness is still considered to be very, very good. In our call answer time, longest wait time is lower than most of the consortia in the state. And so far looking really well. We are moving into the open enrollment period, so that will be ramping up, and so we'll be managing those federal marketplace applications. Also for our economic support unit, the heating season started. That's October 1st that started, so the 25-26 WEAP application period has opened up, and we're rocking. We've got appointments out a month already, and also taking paper applications. We did a outreach with the food shelf, the Hayward Food Shelf. We were there a day and gave out applications, and also gave members information regarding food share, Medicaid, and tried to answer some questions that people had as far as their benefits and what the future of those benefits look like.
Any questions for Shauna? I did just put in an update that came out the end of August on just the impact of the federal budget reconciliation bill, just so that you kind of can see and be able to speak to any of the things that are potentially coming down. The other thing, questions, and I should have said this in my administrative update, with the federal shutdown, so far everything is still functioning fully. There's funding from the state that's able to keep us going. I think WIC is probably the one that they're most concerned about because it has the least amount of, I don't even know what I want to say, funding, residual, backup, in the resources, I don't know, what am I trying to say? Yes, a rainy day fund. That's a good way to say that. So that's probably the one that's most at risk as we move forward. AmeriCorps program is still functioning. We do have 2 AmeriCorps members, and that isn't shut down either. So just wanted to cover that. We can move on to public health.
I just wanted to report on Clean Sweep. It was a significant increase over our previous years for the number of vehicles that came through. We did add the electronics recycling, and that number came in after my written report, which was 26,657 pounds of electronics were collected on Clean Sweep Day for disposal. You'll note too on my report that our sharps collection for that day was significantly increased as well over the previous year. Medication stayed about the same, but definitely was a busy day out at the fairgrounds. Walk for Tomorrow, you can see the recap there in the report. I will say total raised for those walks plus LCO, Winter, and Hayward was $3,600. That will go back into the community for prevention efforts and awareness for mental health. One thing that didn't make my written report, but I want to make sure to remind you, is our second annual community stakeholder meeting will be at LCO University on October 30. And this will be in the morning from 8:30 until 11:30. This is our project with Healthier Together that Sawyer County Public Health and Tamarack Health does in conjunction with each other as a part of our community health improvement plan. We would love to have you attend. RSVP information should be in your email. So, any questions?
Yeah, the Clean Sweep program you ran, and you saw so much sharps and electronics. Are you going to do that again, or is once a year enough for that?
It's an annual event, and I think we've had it, do you know how many years? I know for sure 3.
Yeah, it's been going on before that, where it was more just the chemical drop-off and those
Right.
types of things. I think probably in '21, I want to say, we got involved with Clean Sweep to be able to add while they were doing a little bit of pharmacy, we were able to add the sharps. This last year, we saw the grant that we could do the electronics, and we were like, let's go for it. Little did we know, I mean, I was stuck in the line and there was no way I could get out. And I had a meeting with LCO ICW and they had to wait for me to get there. So I'm like, I'm stuck. But so great turnout. We learned a lot on how we would set things up a little bit differently going into next year. But if we can get that grant for the electronics, I think people were, we haven't had anything for electronics here. And I was watching what was coming out of those vehicles on electronics, and there were some old, the old big fat monitors. And I mean, there was stuff that people were just unloading loads out of their trucks. So I think really good to get all of that out of the community and out of our environment.
Because otherwise it ends up on the roadside.
And a lot of times ends up on the roadside. So I think a lot of people heard about it this year, and I will be getting into it next year. Those that went this year probably won't have a whole lot of electronics to get rid of next year, but maybe we'll get others to join in, so. Okay, moving into fiscal, I want to lean you into the 2 new reports that I had mentioned last month would be coming in. We used to have it kind of in a long report. It was a little bit harder to read. So looking at and I just want to identify a couple things in here for you to be able to see. We're trying to pull things out to make it a little cleaner. So if we're going into the receipt recap, being able to show what money is coming in. One of the things that we have separated out to make it a little cleaner is really to clearly see, like, what are we taking in on medical assistance when we're doing our billing. So you can see that really clearly if you look at AODA. The other piece, as you go through CCS, we are separating those. We'll have that separated. Well, actually not CCS because we're not having that. I was trying to point to CLTS. There it is. So CLTS, we have CLTS case management. That is the billing that we're doing internally for the staff time, and that is going to that program. And then the CLTS, the other dollars, though, that's kind of a pass-through dollar. So that's for the things that we buy for people through the CLTS program. We purchase things and then that's fully refunded. So this program more than pays for itself. So it's a fully 100% paid for program. The other piece to note that we have not done before is when you look under family services, CPS case management, we've never billed for case management before in CPS. So just started doing some billing and we have 3,000 coming in. So, if we consistently do all of those little things, they'll add up. Same with youth justice, being able to bill for case management services there. As we move through. And then the other thing with those case management services is that also goes into WIMCR. So it's not 100% fully funded, but they do give us a little bang on the back end of that. So if we are billing for case management, then we also have the opportunity to get a few more funds in through WIMCR. So Carrie has been doing a great job at trying to find areas that we can capture revenue. And this will be a long-standing revenue that can come in. Another area that we may be able to do, and we have not fully investigated this yet, but it could be for adult protection services where we would be able to do targeted case management with that one as well. When you look at the purchase service recap, one of the things that we just clearly added in here is, so you can see that we're using grant funds. So it was funding that became available to us, but was not necessarily budgeted. It looks like we've overspent an area when really we haven't. So like if you look in family services and you see other family services grants, that has 561, the youth traffic it has 12,000. It looks like we overspent, but those are just funds that are available that we are able to use that we would have not otherwise had. So, so that is a recap of what we've got going on. Again, it's our out-of-home placements that we're working on to be able to rein those in. And you heard about all the plans for that. Anything else?
Julia, how does the children in care expense report line up with our budget? Are we budgeting enough for that? Because I know that's always been a big expense as well.
Yes.
Our children that are placed out of the home and maybe out of the county.
Yeah,
Right.
we thought that we are overspending compared to where we were at last year. So kind of used that we were coming down on it. We have a few kids now that are in RCCs that we didn't have in RCCs, so that residential care. So really trying to we need to be creative on other placements in order to kind of rein that back in again. Again, you never know when those kids are going to pop up, so it's hard to predict. And I don't know how we do that a little bit more cleaner. So,
Right.
and some of the out-of-home expenses, like with everything that Sarah's got going on, there are some kids that end up in out-of-home care that start out with delinquency or maybe aren't getting the things that they need. So that program will help with some of them. But some of these kids, they are like mental health issues and or a lot of the kids that we have in residential care have had traumatic trauma in their lives. And you don't know when that's going to make it so they have difficulty functioning. So if anybody has a magic wand and can read that future, I will take any advice.
All right, so do we have any committee updates from anyone? Do we have any correspondence or reports from conferences and meetings?
Did anybody go to what was it, in the Dells or something, the Wisconsin counties? Was there anything in there about helping us with our budget and addressing some things?
Not really in the sessions I went to. I went to like 3 different ones that talked a lot about the problems we're all facing, but not a lot of solutions. One of them was though on the centers and talking about the ones that are closing and where they're building new ones, and everything is down south.
Mhm.
So it's not going to be much help for us from the state.
Anyone have any future agenda items that they'd like to get on the books for discussion?
Carol, do you have
Carol's
anything you want to talk
gone.
about next month?
All right, we are adjourned. Thank you very much.
Thank you.